So last year, 2024, precisely on the 20th of December, the FDA approved Tirzepatide for the treatment of moderate and severe obstructive sleep apnea in patients with obesity. Now, this has led to a lot of cascade in the sleep medicine world, but today I'm going to talk about the studies and other things that you need to know. So if you've been wondering, am I the right candidate for this medication? Do I need to take this medication? What do I need to know before starting someone on this medication if you're a physician, or if you're a patient and you'd like to know if you should get on this medication? I'm going to talk about all that today. Now, during the study, or there are two main studies. Let me start out that way, okay? You have the Surmount OSA Study 1. This study was about OSA patients who were not on CPAP that were randomized to Tirzepatide and placebo. And there was also the Study 2, and this would be the OSA patients who were on CPAP and were randomized to Tirzepatide and placebo. Now, they had a primary outcome. They looked at the AHI. Now, AHI is just the number of times you stop breathing. And what they found was that there was 50 to 60% improvement in AHI in both studies. Now, they also looked at secondary outcomes. They looked at blood pressure, noted an 8 to 9 millimeter reduction in blood pressure. Looked at CRP, which is a cardiovascular marker. There was improvement or reduction in CRP levels. Looked at body weight. They saw 18 to 20% reduction in body weight. They looked at the hypoxic burden, which improved as well. They also had a 3-year study where they found that there was a 93% reduction in the development of diabetes. That's really huge. Now, the other things they looked at was the patient's symptoms. Patient reported improvement in both daytime and nighttime symptoms. Now, they noted that the improvement in AHI was mainly due to weight reduction. Now, let's talk about the what they consider to be remission, right? Like I said earlier, there was 50 to 60% improvement in AHI. From the study, 50% were in OSA remission. And the description of remission, or they define remission as two things. One is AHI less than 5, or AHI 5 to 15 without symptoms. And it took 1 year period for them to establish remission. Now, the question is, what happens to someone who has severe obstructive sleep apnea and for that 1 year period before they get to remission? So hold that thought. We're going to talk more about it. Now, let me just back up a little bit for people that don't understand these numbers. AHI is the number of times you stop breathing. Sleep apnea is defined in terms of severity as mild, moderate, and severe. Mild sleep apnea is 5 to 15. I should probably start with normal. Normal is 0 to less than 5, okay? Mild would be 5 to 15. That would be AHI of 5 to 15. Moderate is 15 to 30. Severe is AHI of 30 and above. Okay, now I'm going to stop here for now, talk about the side effects of this medication, talk about indications for this medication, and a whole other things that I will talk about in my next video. My name is Dr. Anna Kute. I am triple board certified in internal medicine, sleep medicine, and obesity. I will see you in my next video. Bye.